Hi, I'm Dr. Tom Wade. I'm a professor of internal medicine and medical director of the Kidney and Pancreas Transplant Program, medical director of the Organ Failure and Transplant Network. I'm in the Division of Nephrology, Bone and Mineral Metabolism here at the University of Kentucky College of Medicine. I've been an attending, for quite a while, 31 years now. I've been medical director of kidney and after that pancreas since 1986, and that's pretty much what I do. About 5 years ago, I limited my practice only to transplantation. I used to do general nephrology as well, and still do some of that, but mostly it's transplant related at this point. Well, the majority of the patients that we see have end-stage renal disease. In other words, they are either approaching total kidney failure or they are on dialysis already. We also see patients with type 1 diabetes who have advanced renal failure who are referred for kidney and pancreas transplantation. So the majority of our patients are in need of a kidney transplant or are pursuing it as a lifestyle change from dialysis, which I don't think is a really good lifestyle, very inhibiting. But nevertheless, that's why they're here. We also see patients with other organ transplants like heart, liver, lung transplantation who have renal failure or renal insufficiency issues. In other words, something along their transplant course has also injured their kidney, and we see them until the kidney injury is improved. And occasionally they are patients who are in need of combined transplantation, such as liver and kidney, or heart and kidney, and sometimes lung and kidney, or kidney transplantation after heart, liver, or lung transplantation has already been done months to years before. It is not something we do at other spots in the Commonwealth. We're more or less you need a more sophisticated hospital with a lot of different facilities and a lot of specialists in other areas such as infectious disease, hepatology, gastroenterology, sophisticated cardiology, etc., because of the complexity of the patient. It's something that we pride ourselves in because we've been doing kidney transplantation here since 1964. And that was only about 10 years after the first transplants were done. The rewarding thing about transplant is the lifestyle change that the patient gets to go through. They are now unencumbered by dialysis 3 times a week, or that they have to do exchanges for peritoneal dialysis on a daily basis. And additionally, transplantation in the kidney field decreases the amount of cardiovascular complications that you get with transplantation, and also improves overall patient outcomes, and also gives a life benefit because of decrease in cardiac complications and cardiac death. The patients feel better, they eat better, they have a overall better lifestyle, and that's what makes it rewarding.